Hi, my name is Angela Stanley. My understanding of substance use disorders have developed through a combination of personal observation, school, and professional experiences. Over time, I have come to understand that recovery is possible and that effective social work practices requires meeting clients where they are, respecting their autonomy, and connecting them with appropriate resources. My experiences have included observing individuals who were introduced to substances at an early age, including situations involving coursing during childhood, as well as witnessing addiction affect family members and others around me. Some individuals achieve recovery while others struggle or remain in cycles of substance use. These experiences reinforce that addiction is not a one size fits all issue and that each person's experience is unique. I have also recognized that media and societal portrayals often contribute to stigma surrounding addiction. Addiction is frequently associated with homelessness, unemployment, criminal behavior, or personal failure. These portrayals can shape public opinion and influence how people experience substance use disorders. As a result, individuals may experience judgment, barriers to treatment, or unequal access to support or services. Through education and reflection, I have learned to view addiction as a complex health condition rather than a moral failing. This perspective supports compassionate, evidence based, and client centered care. Biases and assumptions regarding substance use disorder can become barriers in social work practice. Common stereotypes may include beliefs that individuals with addiction lack self control, intentionally make poor choices, or are incapable of recovery. These assumptions can influence how professionals interact with clients and may negatively impact assessment, intervention planning, and advocacy efforts. Personally held beliefs or previous experiences can unconsciously shape expectations regarding treatment engagement, relapse, or readiness for change. If left unexamined, these biases may reduce empathy or create barriers to establishing trust with clients. To address potential biases, I believe it is important to engage in regular self reflection, seek supervision, participate in continuing education, and consult with colleagues. Using person first language is another important strategy because language influences perceptions, can either reduce or reinforce stigma. Most importantly, I believe there is value in listening to individuals with lived experiences and learning from their stories. Understanding clients' experiences from their perspectives can strengthen empathy and support more culturally responsive and non judgment care. Strategies for growth and development. Self reflection is an essential component of effective social work practices because it increases awareness of personal values, assumptions, emotional responses, and biases that may affect interactions with clients. Reflective practice supports ethical decision making and improves empathy, communication, and therapeutic relationships. Areas where I would like to continue growing include expanding my knowledge of evidence-based interventions, trauma-informed care, co-occurring mental health disorders, harm reduction approaches, recovery-oriented treatment models. I also recognize the importance of understanding how social determinants of health, systematic inequities, stigma, and cultural influences contribute to substance use and access to treatment. Potential actions to improve cultural competence and ethical practice include participating in cultural humility, training, seeking supervision, consultation, engaging in continuing education, and incorporating evidence-based approaches into practice. Seeking feedback from supervisors and colleagues can help identify blind spots and challenge assumptions. Additionally, practicing active listening and approaching clients with openness, respect, and curiosity. Being non-judgmental can strengthen culturally responsive care and reduce the impact of implicit biases. This assignment helped me highlight the importance of ongoing reflection, awareness of biases, and commitment to professional growth. When working with individuals affected by substance use disorder, I recognize that ethical social work practice requires lifelong learning, humility, and willingness to examine personal limitations. I am committed to ongoing self awareness through reflection, supervision, continuing education, and openness to constructive feedback. My goal is to provide compassionate, respectable and evidence-based care while supporting positive outcomes for individuals experiencing substance use disorders and upholding the core values of social work profession.